You are welcome to online lectures with Pharmaternity the Schoolboy. Today we are going to take a look at pharmacology, and we have a question on the board. The question says, compensatory increases in heart rate and renin release that occur in heart failure may be alleviated by which of the following agents? A. Merinone, B. Lisinopril, C. Prazosin, D. Atenolol. Okay, for us to be able to answer this question, we need to look at the classes of which these agents belong to, their mechanism of action. Then we see how it affects or it is related to the question. Let's go. Merinone. Actually, this agent merinone is a phosphodiesterase 3 selective phosphodiesterase 3 inhibitor, PDE3. PDE3 inhibitor. And is positively inotropic. It's used mainly in acute decompensated heart failure, even though it should be used in a short-term basis, although it still have high rate of mortality anyway, but it's not used at the compensatory level. It's not used at the compensatory level. Now, lisinopril is an angiotensin converting enzyme inhibitor. Okay, and lisinopril has no significant effect on heart rate. And as for renin, there are containing issues over renin that some literature says that that it increases renin release. So whatever it may be, it cannot be used in this because it has little or nothing or little effect in terms of release of renin or nothing to compare with what we want to solve here, because what we're actually looking at from this question is an agent that can reduce the heart rate and prevent renin release. So I won't take this. Then prazosin. Prazosin is a selective alpha-1 antagonist. And because it is selective, it has no significant effect on the heart rate, let alone renin release. It has no significant effect to be used in compensatory. Is because it has no effect in the alpha-2 receptor. So I won't take this. Atenolol belongs to the class, is a beta receptor antagonist, but it's cardioselective, specifically beta 1 antagonist. They have this effect of inhibiting or preventing renin release, yes, but in terms of, and also of course basically they reduce heart rates. That one is for sure. They reduce heart rates, but one thing with them is that because of the negative inotropic effect, it also brings up some containing issues, whether atenolol and the carvedilol and what that should be used in such patient. It can be used, but it can be started at a small dose, then gradually increase. But of course, the patient should be stable. It should be on a stable patient. So, for these questions, I would choose atenolol because that is the most appropriate option among these 4 options. That's the most appropriate option. Other ones are off. At least atenolol can reduce heart rate. At least it can prevent renin release. Now, let me say 1 or 2 things in this compensatory mechanism. Actually, what happens is that for whatever reason, the heart failure has multifactorial cause. It's a syndrome. So actually whatever cause, there's a reduction in cardiac output so that the heart is not able to pump enough blood to take care of the need of the body. Now, the body itself will also look for a way to compensate this problem so that the body will not be able to provide the what the heart is not able to do. What provide is a cascade of neuronal and hormonal responses. Depletion in the cardiac output will elicit a lot of things. Renin-angiotensin system will be activated. Sodium and fluid will be retained. At the same time, there will be sympathetic nervous system activated, and there will be vasoconstriction to increase blood pressure. And as this is happening, more load is being given to the heart. The heart muscle will be stretching to accommodate the retained fluid, and the heart rate will also increase. A lot of things come together, but in all, it will get to a point. Yes, it will look as if it's working. This compensating mechanism is working, but it will get to a point it cannot continue again. By that time, hypertrophy has already ensued, and the muscles of the heart stretched, and the further what's going on, fluid accumulation, because the heart cannot pump again, and the muscle has already been stretched beyond limit. There are accumulation of fluid. The pulmonary aspects, there will be accumulation of fluid. The heart will be accumulated. It cannot pump out anything again. The systemic circulation will be in need of blood. So this is what happens when it gets to decompensated. That one is a topic for another day. But based on this question, the most appropriate option here is atenolol. All right. Thank you very much for your attention. Please, if you have any question, feel free to chat me up on WhatsApp. My WhatsApp line is on the screen. Please follow my page and like my page on Facebook. My page name is Pharmaternity, the Schoolboy. Subscribe to my YouTube channel. My YouTube channel name is Pharmaternity, the Schoolboy. It's on the screen. On monthly basis, I organize academic competition. I tagged academic battle with Pharmaternity, the Schoolboy. This competition will help the students or anybody interested to improve in academic performance, to develop a reading culture. It's free of charge. Once you register, you are eligible to write the exam. If you come out as a winner, we have many prizes for the winners. And as I said before now, it is free of charge. Please, if you are interested, chat me up on WhatsApp so I can send you the link for registration. We also need sponsors for this competition. Any amount of money you can get from our sponsors, we go a long way encouraging our children to pursue academic excellence. If you are interested in sponsoring this competition, please chat me up. I'll send you account details for the transfer. The one that is coming on in January 2023, specifically 7 January 2023, that one is is tagged Mathematics Battle 3.0 with Fraternity the Schoolboy. Please like my lecture videos, comment on them, share with your friends, colleagues, students, and children. Someone out there may need these lectures. God bless you. See you next time.